Across the sprawling landscapes of America, from bustling city streets to quiet suburban cul-de-sacs, a silent story is unfolding. We see glimpses of life in its fullest spectrum: a child laughing on a swing, a professional closing a deal, a family gathered around a dinner table. But beneath this vibrant surface, a different narrative takes shape, written in stark, unavoidable numbers. On screen, statistics flash. Over 40% of adults are obese. 1 in 3 have prediabetes. The familiar, comforting images of drive-thrus and late-night delivery are suddenly contrasted with the grace of a morning run, the bright colors of a farmer's market. The land of opportunity is facing a challenge that threatens its very foundation, a crisis not of economics or politics, but of health. We are in the grip of a chronic disease epidemic, a slow-moving disaster that has become the new normal. Heart disease remains the #1 killer, a relentless adversary. Type 2 diabetes, once a rarity, is now a household name. Obesity is not just a cosmetic concern, but a gateway to a cascade of debilitating conditions. Infographics bloom on screen, their clean lines and bold percentages illustrating a grim reality. We see the inside of a sterile hospital corridor, the rhythmic beep of a heart monitor, the worried face of a daughter holding her father's hand. These are not just statistics. They are our parents, our neighbors, our friends. The crisis has a human face, etched with concern, and a quiet plea for a better way forward. The toll of this crisis extends far beyond the physical body, seeping into the very fabric of our mental and economic well-being. The daily grind, the blare of horns in gridlocked traffic, the relentless pressure of deadlines, the flicker of a screen late into the night, fuels a pervasive sense of stress and anxiety. This mental burden is compounded by a crushing financial one. We see a kitchen table littered with medical bills, their figures adding up to an impossible sum. We glimpse the massive, impersonal machinery of pharmaceutical production, a stark reminder of our reliance on treatment over prevention. The cost is measured not only in dollars spent on prescriptions and hospital stays, but in lost productivity, diminished quality of life, and the quiet erosion of our collective peace of mind. Yet, even in the face of such a daunting challenge, a powerful call for change echoes across the nation. It is a movement born not of despair, but of hope and resilience. The final scenes are not of sickness, but of strength. A lone figure stretches as the sun breaks over the horizon, painting the sky in hues of orange and pink. A family laughs as they chop fresh vegetables together, their kitchen filled with warmth and connection. A doctor leans in, listening intently to a patient, their conversation a partnership in wellness. This is the path forward, a conscious choice made every day to reclaim our health. It begins with one small step, one healthy meal, one conscious breath. The final shot lingers, a close-up on a pair of running shoes being tied, ready for the journey ahead. The question hangs in the air, unspoken but understood. What future will we choose to build?